It's Mari McInerney from Croakey here, and I'm speaking with one of the keynote speakers at the conference. Anita, would you be able to introduce yourself and where you work and what you do, please?
Sure. It's a pleasure. My name's Anita Mahajan. I work at the Mayo Clinic in Rochester, Minnesota. I'm a radiation oncologist, and I serve in many different roles, but one of my prominent roles is as the medical director for the Proton Center in Rochester. My area of clinical expertise is pediatric patients and adult patients with CNS, or that is brain tumors.
And we'll talk about proton therapy a bit later, but can you talk about how you managed to come into a field like this?
So my evolution into radiation oncology was a bit of circumstances, and I'm very, very happy that and feel lucky that I landed in it. And then I finished my training at McGill in Montreal, where I'd also done my medical school training. And then after finishing my residency, most of us are encouraged to do a fellowship. And so I chose to do that in Boston at the Harvard Cyclotron. So that was my first introduction to proton therapy. And I feel fortunate there too, because I met many of the giants in proton therapy that really started the field, developed a huge understanding, and sort of were the initial fathers, Dr. Soot, Dr. Leach, Dr. Munzenreiter. I have high regard and esteem for them. So I did my fellowship there, learned about proton therapy, took a little bit of a break, and during that break, you continue to learn your skill. You develop a know-how for radiation oncology in general, started developing an expertise in certain areas. And then when I moved to MD Anderson, that coincided with proton therapy coming to MD Anderson in Houston. So I came back to protons, and since then I've been there all along. Proton therapy is an amazing tool for the right patients. And really what, in the end, it's going to do is going to improve the quality of life that may translate to quantity of life for our patients.
Let's talk about that then for the moment. The benefits of proton therapy. You made the point of saying that it's not an experimental thing, it's quite new, 70 plus years. It's quite old, 70 plus years. But it's taken a while to spread. Can you talk about what it actually is, its benefits, and then why it's really only on the cusp?
Sure. So the earliest patients were treated in the 1950s, and they were in physics labs. So the Harvard Cyclotron was a physics establishment. NASA was doing their experiments there, but it became clinically available 4 days a week. And it was restricted to treating patients with skull-based tumors and eye tumors. It was an awkward place. It really was in a hospital setting. So our early experiences were very limited and very selective, and it was done on government funding. Now, despite that, 10,000 patients were treated in that facility, and it shut down in 2002. And by then, the hospital-based, gantry-based, meaning that you have more flexibility in how you treat patients, started coming through, first in Loma Linda, then Mass General put in a hospital-based facility, and MD Anderson followed suit. So suddenly you have 3 big centers being able to do radiation with proton therapy to a larger number of indications, a larger number of patients. And that's where there was really that critical mass and that threshold where our experience and innovation and treatment delivery really exploded. So since the early 2000s to now, worldwide, we've treated over 350,000 patients. A wide number of indications, a lot of children, and a lot of adult tumors. So I would say the use case, the delivery is not experimental. We continue to refine our ability to manipulate the nuances so that we can use it optimally. We do that with X-rays too. We continue to refine our approach with X-ray therapy, and similarly in any new treatment paradigm. Protons, they eliminate the exit dose. So when I'm treating a patient from one side, nothing exits the other side. So if I'm treating a patient with a parotid tumor, which is on the right side, their mouth, their teeth, the nose, the face gets less radiation. Why would you want to treat that if you don't have to?
And that's particularly important for children, yeah?
Children is even more, it is very important for children, but I again want to say that many of our adults would benefit from similar reduction in dose, reduction in irradiated volume. Sure, adults have mature tissues, but they're at risk for similar things like mucositis, sore mouth, dry mouth, cavities, poor dentition, if you're treating the oral cavity unnecessarily.
But just with children, you did talk about how with higher survival rates, there are challenges from traditional treatments that proton therapy can possibly alleviate. Can you talk to that?
Sure. So children, we're lucky enough that pediatric cancer is rare enough that we make a lot of concerted efforts to improve outcomes. So nationally and internationally, a lot of cooperative group studies have shown and led to better outcomes. We've refined our treatments with systemic therapy, chemotherapy, surgery, and radiation. And each of those have their set of side effects. With radiation, we know that any tissue that's growing and maturing can be injured. It can become not mature, stop growing, stop functioning. And that can lead to health issues down the road. We have many studies from the 1970s on, large studies showing the impact of radiation and how it can cause quality of life issues, quantity of life issues down the road. With proton therapy, what we're able to do is reduce that bath of radiation to the structures around the target that are unnecessarily being treated with other modalities. With protons, as I mentioned, they go in and then they stop. With x-rays, if I'm treating something near the spine, it goes through and exits through the abdomen, hitting the liver, the stomach, the pancreas, all of these structures that could have impact, even with low doses of radiation. So with children who we know are going to survive and are improve, and our survival rates continue to improve, if we say we have 70-80% overall survival for our patients to live 10 years, that 4-year-old is only 14, and if they're not growing well, if they start having tummy problems, if fertility is going to be impaired, their endocrine functions are messed up, their kidneys are messed up, all of these are going to impact their life.
So you've said that 350,000 patients globally have been treated with proton therapy, a lot of that happening in the United States, and including for some Australian patients, because we don't have a facility here yet, and the one we thought we were going to have and was due to open just up the road last year hasn't, for a number of reasons. Does that surprise and worry you?
I'm not surprised necessarily, but disappointed, I would say, and I understand that there has been technical issues, but what makes me happy is that there is going to be a center here in Australia soon. There should be one in Australia, and the first one should just be that, the first one, and there should be a second one and a third one, so that there can be equal access to this important technology for our patients. It's an expensive endeavor. That initial infrastructure development, building development, equipment purchasing, it's a lot of money, but ultimately these machines work for 30 years. They serve thousands, tens of thousands of patients. So if you divide the cost over that many patients' quality of life and years attained, I would say it's well worth it, and Australia should definitely get on board and get their first one in and start planning number 2 and 3 and 4.
Fantastic, thank you. Now, the US has really led the way in the proton therapy. We can't let anybody who's living and working in healthcare in America leave without a question about what is it like there at the moment under the Trump administration, particularly for healthcare, health research, health policy.
It's an interesting environment. It's very uncertain about where things are going to land. The leaders that have been placed have very different viewpoints and approaches than what we're used to. So many of my friends who are in research are somewhat worried about their well-being and the sort of the security of their research and the funding. I'm disappointed about this turnaround and this disruption. I do hope it settles down and that saner minds prevail. From the healthcare perspective, right now it hasn't impacted our current situation. I worry that in the near future there's going to be some massive disruptions that lead to problems.
Can you say what's worrying you, what you would fear could happen as a result of this trajectory?
I think the infrastructure that's been developed over many, many, many years, there may be some redundancies, there may be some sort of like need to clean up some things, but at the same time, it takes a lot to build a house and it's easy to destroy it. And I think there should be some value and understanding to really, before everything is torn down, that they really understand that it's going to be very hard to rebuild. And so that interval where things are being rebuilt, there could be some lack of access to care, education, primary care services. I just don't know.
Any other reflections on being here for this very short trip that you've made? Anything that you've observed or that it's got you thinking about?
I'm jealous of the weather. And everybody's lovely and people are wonderful here. The access to the vineyards and the beautiful scenery, wonderful. And meeting friends and developing those deep relationships has been wonderful.
Well, thank you very much for taking the time today.
Thank you.
Cheers, Anita.